Not enough people in Tairāwhiti understand or are familiar with New Zealand Sign Language, a community support worker says. New Zealand Sign Language is one of the official languages of this country. It is used by deaf people and those linked with them, such as people who have deaf relatives or interpreters who work with deaf whānau. Gisborne Care and Crafts Centre supervisor Dot McCulloch has been working at the centre for 33 years. The centre provides a range of interests and companionship for adults with disabilities or lonely housebound people. It runs on volunteers and the support of the local communities. Some people who take part in the centre activities are deaf and hard of hearing, and many rely completely on New Zealand Sign Language. Among them are Penny McNamara and Betty Fox, both of whom communicate through New Zealand Sign Language, lip and facial reading. Mask wearing due to COVID-19 restrictions is a huge communication barrier for them.
That's where the difficulty is. If people talking to them and not realise they're deaf, and they can't lip read because they can't see their lips, it's difficult.
Miss McCulloch said she had gone into shops and pretended to be deaf, and the reaction was disappointing. Miss McCulloch said with the lack of a local deaf support service and lack of awareness about New Zealand Sign Language, there was little help available for deaf and hard of hearing whānau in the region.
And it is classed as an official language in New Zealand. You need more people learning it and knowing about it so that they can help those people, because as more and more people are getting, I'm going to have to get hearing aids, and the fact that I've got a little bit of sign language, it's a help to me because I can indicate when I'm talking to these, I need the scissors or I need such and bits and pieces, and if it depends what they're doing and what I'm doing for them. Like I took her over this morning to get her vaccination pass because she didn't have one, she didn't know how to get one.
A Howrah Tairāwhiti District Health Board spokesperson said patients unable to communicate clearly because they could not speak or hear did qualify for a mask exemption. According to the Ministry of Health guidelines, there are situations where face masks are not needed, including when communicating with deaf and hard of hearing whānau.